Okay, so tomorrow I am supposed to go in for my surgery that's called a septoplasty, and it's basically where my ENT is going to roto-rooter out my sinus cavity because my septum is deviated. That means it curves or goes over to the side or is obstructing my airway in some way, which over the years has caused me to get innumerable sinus infections. I've had these since I was a kid, so for decades, but over the last couple years, they've been recurrent, and I've had to go on antibiotics multiple times per year. I've tried a number of different remedies. I've tried homeopathic remedies. I've tried all different types of nasal irrigation and rinsing. And I actually did pretty serious damage to myself, apparently, at one point when I decided no matter what happened, I wasn't going to go on antibiotics. So I was going to fight this thing off through nasal irrigation. I put additives into the nasal irrigation, such as tea tree oil, which is an antibacterial. I've put apple cider vinegar into the nasal rinse. I've put colloidal silver into the nasal rinse. I've put almost everything I could think of. But on one occasion, when the sinus infection lingered, I apparently developed scar tissue in there because eventually, after a couple of months, I started to have serious pain in my upper teeth area, and I eventually had to go on the antibiotics to try to stave it off. Within 48 hours of being on antibiotics, I felt better, and I'd been dragging around, almost incapable of doing what I needed to do for several months at that point. Since then, my sinus infections have actually been more frequent and worse, so that didn't do me any good. But I am tired of going on antibiotics constantly and being decommissioned because of these. So tomorrow is my septoplasty, and I'm going to try to do a journal about how that goes. For now, it is February 14th, 2018. My surgery is tomorrow, day after Valentine's Day, and I am having the surgery at a local surgical center. That's where my ENT does almost all, if not all, of his surgeries. I did go ahead and look online a little bit. I was a little nervous about going to a surgical center instead of a hospital in case of there being complications. However, there are two hospitals that are both within a 5-minute, maybe 10-minute ambulance drive from the surgical center if there were any complications, and they keep an ambulance on hand. And this ENT has been practicing for many years. He's done thousands of these procedures, and he does all of them out of the surgical center. So, in general, I'm very averse to doing anything with doctors. I'd rather try to take care of it at home. I am pretty nervous about it. I'm nervous about the anesthesia. I'm nervous about the procedure itself. But every single person that I've talked to who has suffered the way I have and who's gone ahead and had the procedure has absolutely endorsed it and was glad that they did it, and in fact said that they wish they'd done it sooner. So I did not let myself go online and Google images or pictures or blog posts or experiences or YouTube videos of anybody else who'd had the procedure done until last night, when I succumbed and I looked around a little bit. Some of the pictures were pretty rough, but I guess it was important that I saw that because I do need to at least warn my children about what to expect when they see me for the first time. I don't want them to be surprised. So I am expecting to have several different types of nasal splints in there. I am expecting to have to wear some type of a bandaging or dressing. Some of the people's looked more like a mask, whereas some of them really looked more like a Band-Aid on their nose. I don't know what my situation is going to be like. Some of the people seem to recover fairly well within a week or two. Some of the people said that several months and they were still hoping for full recovery. In any case, we'll see what happens, and I will post some more videos. I don't know how well I'll be able to stay on top of it, but I'm going to try to at least do a journal of it. my medical instructions for now are that I have to follow typical procedures for anyone going under general anesthesia. And that is that I have to stop eating by midnight tonight. I have to stop drinking 2 hours before the procedure. Between midnight and 2 hours before the procedure, I'm allowed to have clear liquids, apple juice, black coffee, and that kind of thing. We'll see how that goes. My procedure is not until 10:45. I have to show up at the surgical center at 9:15. Lucky for me, I just happen to live walking distance from the surgical center. I'm probably going to walk to the surgical center, even though it is cold here, and we've had wintry temperatures, everything's below freezing, but it's close enough that I'll probably walk over, because my mom is planning to come and pick me up after the procedure is over, and she can't make it until after I'm supposed to be there. When I had the call from the surgical center earlier today, they did tell me that I had to have a driver to drive me home. They also did tell me that I had to have someone who would be staying the night with me the first night, at a minimum one night. And I think she even said it would be preferable to have someone for the first 2 nights. Although I got the impression that that was more to make sure that I didn't have complications from the anesthesia or need to be readmitted to the hospital for any reason. So we'll see what happens. I am not looking forward to it at all. I do feel pretty nervous, but it's something that the doctors have told me I needed for a while. And I have at least one family member, that's my father, who had the procedure done a number of years ago, and it was very successful for him. And so I'm going to be hoping and praying for the best, and I would appreciate your prayers as well. Thanks so much.